Another thing that we're doing in our office and that a lot of people are doing, they're getting your blood, they're spinning it down, they're getting your plasma where there's a lot of growth factors, and they're using that into ligaments, sometimes joints, etc., to try to use those growth factors to reactivate, to rejuvenate, to regenerate those ligaments. Okay? Once those ligaments are healthy and the sacrum is not moving all over the place, a lot of the back pain goes away. So you can have a patient come in, and this is really, like the iliolumbar ligament, for example, I'll show you. That's the distribution. When the iliolumbar ligament is injured, people are going to have a lot of pain in the inguinal area and in the testicle. So a lot of the poor guys, and in the thigh here. A lot of the people come and say, my testicle hurts, and you do an ultrasound, and the ultrasound is fine, and everything is fine. I mean, we've had a couple of guys that say, you know, I want my testicle out, and I'm like, whoa. You know, let's not go there yet. And it is hard for them to understand that the pain is not local. It's being transferred from here. And so a lot of one of the papers that we presented at the Pelvic Pain Association a few weeks ago was how to treat these patients with trigger point injections that address iliolumbar ligament injuries, lower back, etc. And the results have been really remarkable. We're going to add to that injections into the iliolumbar and see if we can even make it, you know, a faster recovery. If you have posterior sacroiliac ligament instability, if you inject that ligament and you fortify it, you regenerate it, then a lot of those symptoms go away. He presented 2 papers in the International Pelvic Pain Society, I mean 2 abstracts, I'm sorry, not papers. And it was really exciting. One of them was the success of trigger point injections to the hand and ankle acupuncture points, addressing the chronic testicular pain. That was good. I mean, a lot of these people are desperate. They've been on pain pills forever. They just, you know, and our results are pretty exciting. They're preliminary. It's not like I could say we have 100 people. But I mean, these people that nothing else was helping them.
What kind of numbers are you seeing with the trigger points and the testicular pain?
Oh, pretty. Tom, do you want to talk about that a little bit? He's our acupuncturist.
Yeah.
Well, I mean, the small survey that we've been doing, the number of people that we've done, we're running almost 100%.
Wow.
Probably, you know, out of 12 or 13, there's probably 1 that didn't respond. And these are guys like what she was saying, who wanted to cut off a testicle because the pain had been there so long. He was just over it and didn't have any other option. After the first injection into the trigger points, he goes, it's gone. I mean, it was immediate. It was an immediate change. Now, it takes multiple treatments to finally get everything to cool down, but it was an immediate response. So the nice thing about that is it tells them right there, this is a good therapy because it gave me immediate response. We just need to do it a few times. But it's one of the more successful ones we've seen so far.